Hi, thank you so much. It is a great pleasure to be here with you all during what are different times at least, but I'm happy to be here. My name is Tina Sherman. I'm campaign director with MomsRising. And MomsRising is an organization representing moms on a variety of issues, as you see here. We work on a variety of family-friendly policies, everything ranging from immigrant rights to access to healthcare, to access to paid family and medical leave. And our goal really is to lift up the voices of real families across the country. We have over 1 million members. We're made up of moms, dads, and grandparents. And we really are here to lift up the voices of real families as lawmakers and other decision makers are deciding and talking about what issues need to be addressed from a policy level. So many of our members have gone to Washington, D.C., also participated in rallies, and been to White House summits, really, again, just centering the voices of real families as policy is being considered. And we also have MomsRising, which is our Spanish language community, and we work hand in glove with MomsRising, lifting up and centering the voices of Latinx families and the particular challenges that they are facing. I really want to focus now on our work in the breastfeeding space when it comes to policies. We are all aware of the disparities that women, particular women of color, face when trying to meet their breastfeeding goals. We know that the barriers are greater when it comes to African American women, as well as Native and Hispanic women. And some of those difficulties we have heard come directly back to the lack of access to breastfeeding advice and support. Discomfort in breastfeeding in public, and concerns about working and breastfeeding. So MomsRising really comes at this from, if these are some of the central concerns that parents are facing in trying to meet their breastfeeding goals, how can we address those from a public policy standpoint? So when we talk about public policy, I don't know where everyone in the room is coming from in their understanding, but I would love for everyone to take just a moment and think about one policy that might be able to help support and empower breastfeeding families. You could take a moment just to think about that. So I want to show this video that talks a little bit about some of those challenges.
Expectant moms are inundated with messages about what's best for their babies. Eat this, don't eat this. Use this product, but not this one. Breast is best, right? In all the noise, moms often feel unheard, unsupported, and without a reliable roadmap. Those first few days and weeks with baby are incredibly hard. The challenges are real. That's why we need to advocate for public policy solutions that support moms and strengthen families. If moms and babies want to meet doctor-recommended breastfeeding goals and feel empowered to navigate the struggles of parenthood, then they must have access to lactation education and support, as well as public policies like paid family and medical leave, so they have ample time to heal, time to establish breastfeeding routines, and time to bond with their new baby. Moms returning to work need adequate break times to pump and a place to store breast milk, as well as access to high-quality, affordable childcare. Healthy babies and supported parents make for stronger families. Join MomsRising today to support breastfeeding moms.
So MomsRising really works on public policies that can help eliminate barriers, encourage breastfeeding, and help decrease health disparities. These we're going to cover today are just 3 pieces of legislation that are meant to normalize and support breastfeeding parents. So first and foremost is the Family Act, and that is a Paid Family and Medical Leave Insurance Act. It exists both in the House and the Senate, and it establishes a paid family and medical leave insurance program, allowing families to take time off after the birth or adoption of a new baby to care for and bond with that baby, also to help establish breastfeeding routines. And we also have the Pump for Nursing Mothers Act. And this legislation fills in some of the gaps that that exist in the federal law. So currently federal law requires most hourly wage earning and some salaried employees reasonable break time and private non-bathroom location to express breast milk for 1 year after the child's first birth. These federal policies were a great first step, but it does leave out millions of workers without any protection. And the Pump for Nursing Mothers Act would help to close some of those gaps. And finally, there are administrative actions in education that can happen both at the federal level and at the state level, and also with corporate partners or corporate organizations to, again, help empower and support breastfeeding families. So right now we know that 71% of all mothers work outside of the home, and that mothers are the sole or primary breadwinner in 40% of households. And most importantly, and astonishingly, every time I read this, 1 in 4 mothers go back to work within 2 weeks of giving birth, unable to establish breastfeeding, continue bonding, or to heal from birth. So the first policy we want to talk about is paid family and medical leave. Right now in this country, only 17% of American workers, and that includes 15% or 5% of low-wage workers, have access to paid family and medical leave. Fewer than 40% of employees have access to personal medical leave through their own employers. And when we look at who has access to paid family and medical leave, the disparities are not surprising and yet astounding all at the same time. Only 25% of Latino workers and 43% of Black workers have reported having any access to paid or partially paid leave, compared to 50% of white workers. This has serious implications for racial health disparities, particularly as they relate to infant mortality and low birth weight. So given that we're living in the middle of this pandemic, I want to talk about some of the great strides that have been made over the last few years, and specifically over the last few months, towards offering paid family and medical leave. First and foremost, there's been a lot of action at the federal level, including several hearings where moms and dads and business owners spoke before Congress, talking about the importance of offering paid family and medical leave. In the first piece of legislation that was intended to be relief for the COVID pandemic, the Families First Coronavirus Act and the CARES Act were passed by Congress, and both of these included emergency paid leave and paid sick day provisions. We were incredibly excited about this, about these being enacted, because when you think about what we need working through this pandemic, we absolutely need to have paid sick days and paid family and medical leave, so that workers, if they have been exposed or if they're sick, they're not returning to work. And then also, if their family member is sick, so that they can take time off to take care of that family member. So we were incredibly excited that that these were adopted by Congress. Unfortunately, it was a great first step, but at the moment, Congress did not go far enough, and it currently only covers 25% of the workforce. So again, this is a great first step, but we are advocating to close the gap and to expand this policy to be inclusive of all workers. So I want to go back and talk about paid family and medical leave, and specifically how it relates to supporting breastfeeding moms. Again, that statistic of 1 in 4 moms going back to work within 2 weeks of giving birth is heartbreaking. We know that the lack of paid family leave further widens the pay gap and can drive families into poverty, creating a whole level of stress that's just unnecessary. Paid family and medical leave provides families with paid or with economic security. So MomsRising is advocating for a comprehensive paid family and medical leave program. We need a program that's accessible to all working individuals, not just parents. It needs to really be for the family who's providing care for a young infant and an aging relative, or for a spouse who needs to support their spouse while going through cancer treatment. We need it needs to offer a meaningful length of leave, at least 12 weeks, covering the full range of personal, medical, and family caregiving established under the Family and Medical Leave Act. It needs to be affordable, cost-effective for workers, employers, and the government, and that is really what this insurance program would do, allowing individuals, workers, and employers to contribute to an insurance fund, then available to take the benefit when you need it most. It also needs to be inclusive when it comes to defining family. And finally, it needs to allow working people to take leave without facing adverse employment consequences. You need to be able to take paid leave without fear of losing your job. And I want to be clear, the details matter. When it comes to a national paid family and medical leave program, we cannot accept dangerous or incomplete proposals. There has been lots of discussion at the federal level on both sides of the aisles about what's the best way to provide this program. And we really can't accept a proposal that raids our Social Security funds and cutting those safety net programs. It's really not okay. We can't force families to choose between caring for their newborns, their new infants today, and bargaining against their retirement income. Also, we can't rely on personal tax-free savings account. It's really unrealistic and unfair. Most families don't have access to extra income to put it away. Most folks don't have enough to handle a small medical emergency, never mind going weeks without an income. So we can't rely on a personal tax-free savings account. And on the national level, focusing on an exclusive parental leave program doesn't work. It really needs to be a comprehensive program that covers all caregiving needs. That's really the only way a national program will work. So now I want to move on and talk about some other public policies. I'd love to get your ideas on this. What percentage of women do not have access to appropriate workplace accommodations to express breast milk? Is it A, 20%, B, 80%, or C, 60%? Take just a moment and think about which one. And the answer is 60%. 60% of women do not have basic workplace accommodations or adequate break time. Under current law, specifically the ACA, the Affordable Care Act, requires employers for most hourly wage earning and some salaried employees reasonable break time and a private non-bathroom location to express breast milk for 1 year after the child's birth. This is a great first step, but it leaves out millions of workers, including salary workers and some teachers, without any protections at all. The Pump for Nursing Mothers Act would ensure a fair and uniform national policy by extending the existing federal provisions to cover approximately 12 million additional salaried employees, including elementary and secondary school teachers. MomsRising actually wanted to raise awareness about the fact that the majority of working women do not have access to basic workplace accommodations. So we launched a hashtag IPumpedHere campaign. The idea was to laugh so you don't cry and then demand change to bring breastfeeding women out of the bathroom stalls, inside from their cars, and into pumping rooms that they deserve. I want to share this video with you to talk about our IPumpedHere campaign. Oops. 1 in 4 U.S. moms return to work within 10 days of giving birth. 60% of moms do not have workplace accommodations to express breast milk while they return to work. These are just a handful of the barriers that many women, particularly women of color, face in trying to breastfeed their babies. So please, I would encourage you to check out that that campaign across your social media platforms, hashtag IPumpedHere. I encourage you to contribute your own stories, encourage your families that you work with to contribute their own stories. They can include a picture or just share their personal story about places that they have pumped. We're really continually, until we expand these loopholes, we're continually trying to educate our lawmakers about the challenges that moms face in finding appropriate places to pump their breast milk. And the last item I want to talk about is administrative actions and other opportunities for education. So there is the legislative method, which is obviously incredibly important, and we must work to advocate for public policies through legislation to support breastfeeding moms. But there are other ways we can as well, including asking airlines like Frontier Airlines to support their employees and their clients to include that they're able to breastfeed and not have any difficulties in doing so, as well as weighing in at the Department of Labor when they're asking for comments on particular policies that they're enacting or changing. And the last campaign I want to highlight is one that we did with Anthem. Anthem is a health insurance company, and they were attempting to decrease the reimbursement rate on breast pumps. And this was going to cause, we were incredibly concerned that this would cause women to have access to a lower quality breast pump when, if you're working full time, you need a good quality breast pump to be able to express the milk that you need on a regular basis. And so we launched this campaign to encourage Anthem to rethink this policy, and they responded. We had Alyssa Milano, we teamed up with Alyssa Milano, and I'm going to share this video here with you in a moment, where we really said that Anthem needed to hear moms and ensure that moms were not getting a lower quality breast pump. So I want to share this video with you.
Hi, I'm Alyssa Milano, actress, activist, and mother of 2. Breastfeeding my children has been one of the greatest joys in my life, and I am so proud that my body was able to provide them with the sustenance and comfort they needed to grow and develop during their first months of life. Formula should always be easily available for women who cannot breastfeed or choose not to. But my goal is to normalize breastfeeding and make it easier for new moms to feed their children with their own bodies. And that's why I teamed up with MomsRising to start a Care to petition urging Nestle and Abbott Laboratories to put the health and well-being of moms and babies above corporate profits, right? Yeah. Please visit care2.com/momsrising to add your name. A recent study by the World Health Organization found that optimal breastfeeding could prevent about 800,000 child deaths every year. Join me and Milo in helping to save babies' lives as we celebrate World Breastfeeding Week. Thank you so much.
So now I know you were all inspired and wondering, what can you do? Well, you can absolutely get involved. In fact, your voice is key. We have to continually urge our lawmakers to hear the voices of what real parents are going through as they are trying to raise their families. And we particularly want them to understand the challenges and the barriers that women of color and that breastfeeding moms, women of color and breastfeeding moms are facing. So I want to talk a little bit about what you can do. First of all, sign up for MomsRising.com and you will receive our action alerts sharing when legislation is pending before Congress that you may be interested in weighing in on and letting your lawmakers weigh in on. Second of all, and most importantly, we want to hear your stories. This screen to the left shows you we're collecting stories from breastfeeding and pregnant parents about their experiences of breastfeeding during the coronavirus pandemic. And we're sharing these with lawmakers and with government agencies as they are contemplating how they can best support parents and ensure that the best policies are enacted to enable to better inform policies that they're enacting. And again, signing up for our email will let you know. This one on the bottom here is specifically about protecting our health care when the ACA was under attack. So that's the first thing that you can do. Share your story on social media. You can also hold a mom's meetup. And I know nowadays those look a little different. There's going to be some social distancing involved, and they might be virtual, which is great. This is, we've been able to share this content virtually. You can share all of this information virtually, and it really helps families to not feel like they're so alone. And obviously sharing your story with decision makers. On social media, I always love to highlight Black Breastfeeding Week and Black breastfeeding. It really does help to showing and sharing images, using those hashtags to do that, really helps to set expectations and create expectations when it comes to breastfeeding, and is so incredibly helpful. Also consider providing technical support advice online through various Facebook groups and through tweet chats. And I know that several lactation consultants and other providers often are engaged in online communities, creating, helping to foster relationships and support. Those are really, really incredibly important tools to help share your story, share the stories of the families that you're serving. These are incredibly important tools. And our moms meetups, of course, we won't be doing them like this for a little while, but again, online, we, MomsRising, can help provide the content. You pick that venue, whether it's, you have opened up your circle a little bit and you're social distancing with a neighbor, or maybe it is just online. So you pick that venue, and then you just let us know how it went. And then we also regularly visit with and speak to, and we've already been doing this virtually with lawmakers and decision makers. So, you know, if you're comfortable, again, you know, so, we can take you with us to visit your lawmakers, and that's a place where you can share your story as well. Also consider writing letters to the editor. Those are always incredibly helpful. It's a way to lend your voice. Our lawmakers do read their hometown papers, so that's incredibly important. And then I want to share with you just a couple of visits that we have done over the years. This one was with the Affordable Care Act. We met, we were on Capitol Hill. We met with Senator Lisa Murkowski's staff. And this was at a really critical point in 2017, when we were talking about the importance of not changing the ACA and supporting the ACA. These two pictures here, we were at a state legislature talking about the need for access to healthy foods, and we set up a booth with healthy foods, like a farmer's market. And and our final pictures, we visited with the North Carolina Judicial Center. There were some issues surrounding moms breastfeeding during jury duty, or even serving on jury duty, or visiting and working with, interacting with the judicial system. And so we, you know, spoke out for parents then and said, you know, no, our families, our moms need to be able to have access to be able to breastfeed during these times. That's incredibly important. And so they took our petition and conducted some training with judges and with their staff, and reiterated that it's their right, that it's a breastfeeding parent's right to be able to breastfeed. So I just want to reiterate that your voice matters and that you can make a difference. Please follow MomsRising. We're at momsrising.org. Sign up for our action alerts. Share your experiences in our story bank. And visit with a lawmaker or another decision maker. That's all I have. These are the ways you can reach out to us. Join us. Text moms to rising at 747-464. We're at Facebook at MomsRising, and also on Twitter at MomsRising. Thank you so much for your time. I really appreciate it. And now I'm going to hand it back off to the folks at USDC.